Hello, my name is Nathaniel Osgood, and today I'm going to be discussing a number of ways in which simulation modeling in health and healthcare changes our way of thinking about complex health systems. One of the ways is by forcing us to explicitly think about causal mechanisms involved, moving beyond associational reasoning that looks at the patterns of covariation between different variables and tries to, in a reductionist way, tease apart the variation in one and to variation in the other. And instead reasoning about the underlying drivers for associations. Associations may or may not last following interventions. But a more fundamental level of reasoning is to think about the causal relationships that we believe as a working hypothesis obtain between different variables within a system. So rather than dealing in terms purely of relationships between, say, intervention characteristics and broad outcomes, we reason about particular generative pathways, particularly relationships that we posit as obtaining, again, as a working hypothesis between variables. By forcing us to think about these relationships explicitly, we put ourselves in a stronger position to reason about how the system's behavior is likely to change under counterfactual conditions. It also can help us think through very carefully shared pathways for different interventions, maybe placed together in an intervention portfolio, etc. So when we think through the generative pathways, to borrow the language of critical realism, this allows us to come from a position of strength when it comes to reasoning about why we see the behavior that we do and how that behavior is likely to change when we undertake interventions on the system. The exact nature of these pathways will be different naturally from one subdomain to another, but the general feature here that is common to system science modeling to all, with the need to articulate things at the level of these causal relationships. In many cases, these causal relationships will be reciprocal in nature. We'll have variable A influencing variable B, and then variable B in turn influencing A, just as substance abuse might change in substance abuse, say an increase in substance abuse might ripple through and raise the likelihood of a loss of employability and a rise of the likelihood of poverty, which then can ripple back and affect again the likelihood of increasing yet further the substance abuse. In some cases, these causal pathways are articulated at the level of a highly quantitative hypotheses, quantitative enough to make them capable of being tested against empirical data. In other cases, we deal with more qualitative level description. But in any case, we're thinking through explicitly generative mechanisms which underlie behavior and which exist at a deeper level of significance, consistency, and persistence compared to mere associations. A second major change in the way that use of simulation modeling alters our thinking about complex health systems is that it helps us learn more quickly, deeply, and reliably about these systems. And there's really two broad ways in which that's accomplished. One is by making my assumptions shared and explicit. By taking my assumptions out of my head, my sort of working hypothesis of what may be going on in the system, or two competing hypotheses, and putting them down in an explicit form, whether qualitative or quantitative in nature. We can then take a step towards sharing them with others in a way that invites critique in a way that invites refinement by a group, ideally an interdisciplinary group whose expertise we can draw on to challenge our cherished preconceptions, to challenge our current conception of the system, and to advance the understanding enriched by their own perspective, enriched by their own experience. So much of the benefit of modeling for learning lies in the fact that we can make models explicit and shareable. Secondly, by engaging in modeling, we can make our assumptions precise and testable. Far from serving as crystal balls here, simulation models are best viewed as learning prostheses. They're tools, they're learning tools to help us learn more quickly and more deeply. Simulation models in this context help us learn more quickly by helping us think through the implications of our assumptions more consistently, quickly, and thoroughly than we could do in our head. They allow us to take a posited set of processes, as described quite explicitly and precisely within a simulation model, and to see the dynamics that are implied by those posited processes within the model. And we can then test whether those implied dynamics indeed match our empirical observations about the system or the experience of those who have been operating within the system. The idea here is that by stating in a precise fashion what our assumptions are, we can put whatever empirical evidence we have to better and more complete use by allowing us to use it as a crucible against which to test our working hypotheses about system behavior. So a dynamic model allows us to go from a precise statement of our hypotheses about the system to an understanding of what dynamics they logically imply to be consistent what would come out of a system if it is described as according to our conception. And we can then test those against a wide variety of different types of evidence. This allows us to, over time, through the use of models, by using the modeling package, the simulation package, to produce output, it allows us to sharpen our mental model, to realize cases where that output just doesn't jibe with our experience, what seems reasonable based on what we know about the system, or the evidence to which we enjoy recourse, and allows us to sharpen our mental model, which is then placed into an updated model. An inconsistency observed between what we think should be, what empirical evidence suggests is the case, and what the simulation produces, is therefore not a failure of the model, but a success of modeling. And here we're refining the mental model together with our model in an iterative way, recognizing the model is not a immutable crystal ball, but rather captures our current thinking about the system and helps advance that current thinking. Along a similar lines, we can use models to iterate more quickly between theory and evidence. We formulate an improvement, a possible improvement to our mental model, we place it into a model, we test the output, and we test the output against data gathered from the world, from the external world, to test whether it's consistent with that data. That allows us to, when we gather new data, to quickly use it to improve our mental model. It allows us to be always on the lookout for for data that may helpfully allow us to falsify our model and advance our understanding. We can also use a model in this way to motivate interventions, checking the consistency of the impact of those interventions on the one hand with what our mental model and indeed the simulation that captures it would expect. Another way in which simulation modeling can change our thinking about complex systems by allowing us to recognize what things do we in fact know about and what things don't we, and what things do we still have to chase down. The reflection here is that often it's not the model, but the modeling process that confers the greatest value in modeling. It's not this crystal ball emerging from the process that conveys us a great clarity and future evolution of a system, but rather it's the reflection process, the learning that goes on with it, that learning that improves our mental model, but also learning that goes on about what evidence do we have about the system. Different parts of our system, different system practitioners who work in different sub-areas of the system, we bring them to the table and discuss their observations about the system, try to capture by allowing them to compare their experience against model results, even tacit knowledge that they bring to bear. In other cases, tapping quite explicit knowledge. And this process offers a great deal of value often on its own, because it allows us to assemble a broader picture of what is known and what's not known within our organization, or more broadly within a health system. And it's this reflection on what is and what is not known that can be particularly valuable. More than that, though, beyond just knowing what we do and do not know, we can use a simulation model to help us understand and sharpen our understanding about which things we do not know, in fact, matter the most. Of the things we do not know, given a certain level of uncertainty in each, they may have greatly disproportionate impact on outcomes in which we're interested, such as illustrated by this diagram, where we examine the effect of a very, very small proportional change, say 1% higher, 1% lower, in some parameter, and we see the degree of effect on an outcome in terms of total incidence for 3 different parameters. As we can see, one of these parameters has enormously disproportional impact to this one, and actually significantly more than this one as well. So we see there's very different level of import of our uncertainty with respect to these parameters on the one hand, with respect to this outcome of interest, total incidence. In other cases, we examine what's the impact of uncertainty about a given parameter that we currently suffer in terms of our understanding of which interventions are more effective than each other. To what degree is this an uncertainty that affects outcomes? Yes, in a sizable way, but doesn't change the relative desirability of two possible intervention strategies? Or to what degree does it have a huge impact on whether intervention A yields greater gains in intervention B, or vice versa? So in these diagrams, we're looking at impact of uncertainty, a fixed level of proportional uncertainty on an outcome from the model. In other cases, we look at the impact of that on our perceived intervention trade-offs. Another key piece of understanding and, in many ways, wisdom that modeling brings to the table is to allow us to better recognize things and delineate things that we can change and those that we cannot change. Things that are beyond our control versus things that are readily under our control. There are certain features of complex systems which, when we build a model about it, become clear that they're going to be in the cards no matter what we do. Because of the large number of undiagnosed individuals who have been built up, it's going to take quite some time to work through our backload of cases. Because of the large number of pre-diabetics that have been built up, we can put all the guidelines we want into effect with respect to certain types of weight management for youth, but we're going to be expecting a large number of diabetic cases for the near future. There's other cases where this exercise with simulation models can illuminate areas of the system where we really can make a very, very big difference, where we're not dealing with great system inertia, where we're not, as King Canute, trying to fight against the tides, but where instead we can have a very material difference on system outcomes. And modeling can allow us to distinguish between these two types of variables, or two types of factors. Another way in which simulation model changes our thinking is by allowing us a deeper recognition of the coupling between issues. This coupling is a pronounced feature of complex systems. These are systems that are not merely complicated in the sense of having lots of moving parts, but are complex in a technical sense. They're typically coupled, tangled systems where an intervention at one place or a change in one place ripples through and affects many places of the system. It's also a situation where combinations of interventions in the system can yield very different outcomes than what would expect by independently summing each in isolation. Coupling occurs within these systems at many different levels. One of them is coupling across spatial scales. Here, for example, we may find that changes in our service delivery are interconnect with population health outcomes. If we discharge people too quickly, population health outcomes may be adverse and they'll represent. There may be cases where, because of adverse service delivery availability, we end up seeing too few spots within the healthcare system. People present, there's too few spots to accommodate them. The lines are long, people balk, and again, people return for care. In other cases, we see coupling between regions. For example, look at how SARS jumped from Asia to North America, for example, in Toronto, or with the spread of HIV originating in Africa but spreading as a global phenomenon. We see also coupling between sectors. For example, what goes on in farms in terms of antimicrobial use ripples through the food chain to affect what goes on in long-term care facilities and hospitals in terms of outbreak of antimicrobial resistance. We see it in the opioids area, where what goes on in a doctor's office in terms of prescriptions of opioids for chronic pain ripples through to drive not just emergency room presentations for overdoses, but calls to fire in police departments. And so we have this coupling between different sectors, between different regions of a system. In other cases, it's very geographic, with local vaccine hesitancy in one area of a province leading to system-wide incidence effects. In other cases, these are couplings across temporal scales. Within the past few decades, attention is particularly brought on the pronounced lifelong shadows cast by in utero exposures, and the later risks that can be associated with them. Say exposure to a diabetic milieu that's poorly controlled, and later risk on the part of the child who is exposed to that milieu to develop type 2 diabetes or metabolic syndrome and obesity. There's also, through path-dependent effects, adverse outcomes from the mother that can be precipitated. Here we see factors occurring in a comparatively small, contained area of the life course, casting very big shadows over the broader life course. Similarly with early life trauma, with risk of chronic disease and mental health later in life. And since the work of Barker, we've been aware how early life adversity can be associated with adverse later life health outcomes. We know well that an infection in the earliest years of life in chickenpox can result, given immune system weakening and the ravages of age, and shingles later in life, or how tuberculosis infection can lead to reactivation many, many years later as a case of active tuberculosis. By a similar token, intervention and prevention and control strategies at one point can strongly impact later manifestations, and an investment in effective broader population vaccination or outbreak response interventions now might lead to big gains in population health later, at later points. Modeling of complex systems help us recognize also the need to jointly examine issues with diverse stakeholders. The fundamental realization here is when we're modeling things as a complex system, when we're explicitly characterizing the system, it often comes out very clearly and in very stark ways how coupled different parts of the system are. Rather than being solitudes, say prevention and treatment, or those dealing with one stage of secondary school education compared to higher education, the different parts of the system are entangled. What goes on in that doctor's office makes a difference to the police experience in responding to overdoses. And this can often change perspective from a zero-sum situation where, I'm jealous or envious of you working in a different part of the system than myself. If you get money, I'm jealous of it. I recognize if I eat your lunch, I'm going to go hungry as well. If I'm shortchanging you, I'm going to eat the consequences. We're all going to fall short in terms of broader system outcomes that we all care about. So this tends to motivate a desire to work towards cooperation, to identify common ground, identify common interests, and realize that if I follow your nest, it's going to follow my own. It gets us to recognize the value of understanding and information being brought to the table from all sides of this complex system, the perspectives that shed light on areas of the system that I don't know about, but also the fact that to really achieve my goals, you need to achieve yours as well. Finally, complex systems modeling in this area can help us strongly raise the chance of people taking ownership of the system, recognizing that a lot of the problems in systems come not from outside entities, from malicious third parties, but rather come from within the system. And the history of interventions in health and healthcare is riddled with cases of well-intentioned but not judiciously chosen types of interventions that lead to policy resistance, cases where their implementation leads the system by virtue of the other feedbacks and coupled mechanisms to push back against, dilute, or defeat, in some cases reverse benefits to the system. These examples are too many for me to go through here. Some of them are listed here, but the fundamental situation is one where we often solve one problem only at the cost of creating another. We overprescribe microbials to get rid of adverse bacterial infections. We end up with drug resistant. We try to restrict the funding for Hep C to save money. to those with significant liver damage, and therefore individuals with poorly controlled viral load levels spread the infection, therefore raising costs again. We try to cut cigarette tar levels to encourage people to spare people from harm of cigarettes, and it leads to people having a cleaner image of low tar cigarettes and choosing to continue to smoke those low tar cigarettes rather than quitting. Case after case, we've tried to solve one problem only to cause another, or worse yet, we undertake an action only to have us smack us in the head down the road. All too often with complex systems, this is our fate unless we make use of system modeling to address the needs to judiciously plan interventions within that system. Thank you very much. It's been a pleasure to talk about some of the ways in which complex systems shape in which simulation modeling shapes our thinking about complex systems. And I hope this information is of help.